Good morning, everybody. My name is Karen Groen, and I'm the Global Director for Gender at the World Bank Group. I am absolutely delighted to welcome you to this webinar on gender responsive social protection in the time of COVID-19. Our webinar today, as you know, is hosted by the Social Protection Interagency Cooperation Board, SPIOC. Before we get started and I make introductions, I'd like to have our attendees introduce themselves in the chat function, your name and your affiliation. We're going to make this a very interactive conversation with everybody, and I would really appreciate, if you're not speaking, to please mute your microphones because that will enable us to hear our speakers better. I'd like to encourage you to post your questions and comments in the question and answer button and not in the chat function if that is okay with you. There's a question and answer button that you should see on your screen, so please post your comments and questions there. I will be checking them as we go through our conversation today. So let me frame this for you a little bit. I think we all know that COVID-19 has not been gender neutral. In other words, the impact of the virus has been different for men and women because of the different roles and responsibilities that men and women have and play in their households and in their economies. So we know that while men have suffered higher mortality rates as a result of the health crisis and the pandemic, women and girls have been disproportionately affected in terms of the socioeconomic impacts. They have taken on the majority of the unpaid care work as schools have closed, as daycare centers have closed, and as services have been scaled back or shut down. They are overrepresented in some of the most vulnerable sectors of the economy, and in many countries they have higher unemployment and job loss than do men, and their jobs are not rebounding as quickly as male jobs. They're overrepresented as well in the sector of informal employment, and they face what I like to call the shadow pandemic of increasing rates of gender-based violence, whether it's intimate partner violence in the home or whether as a female healthcare worker being targeted by stigma and discrimination. So in spite of all of these challenges, social protection is extremely important in this crisis. Social protection has a major role to play in supporting individual men and women and in households to cope, and it has a role to play as well in terms of supporting those who are self-employed and who may not have the types of benefits that are offered to larger firms. So this session is going to explore why and how social protection can respond better, what we can do more of, and I'm really pleased to introduce our fantastic panel today of Margaret Grosch, who's Senior Advisor and my colleague at the World Bank Group in the Social Protection Global Practice, Juliana Martinez Franzoni, who's a professor at the University of Costa Rica, Renana Javala, who's president of the Self-Employed Women's Association and a longtime friend, and Dr. Maureen Mogotsi, who's Chief Director of Social Protection at the National Department of Social Development in South Africa. And I'd like to start our conversation by just getting a sense of the context that each of our three colleagues who are in Costa Rica, South Africa, and India are facing today. So Renana, let me start with you. If you could just give us a sense of the context in India, and then we'll go to you, Maureen, and then we'll go to you, Juliana. Over to you. I think you need to unmute, Renana.
Sorry. In India, as soon as it was known that the coronavirus is spreading, there was a complete lockdown, which was announced on March 22nd, and we were given 4 hours before the lockdown took effect. And it was complete. You could not go out, you couldn't, and the police was not letting you out of your own home. And that went on for 2 months. And one of the results of that was that many, many migrants began walking home because there was no transport. And finally, about 10 million migrants went from the urban to the rural areas, and many of them started returning later. And so the number of infections has been growing and growing and growing in India. I think we're the second highest number after the US. Now everything is open. There's no lockdown except where in containment zones where there's a lot of cases. But the economy has not really recovered at all. Maybe 1/3 of businesses have recovered. A lot of the people we work with, the informal sector, have not been able to go back to work. So there's a lot of loss of income.
Thank you, Renana. Maureen, what's the situation like in South Africa?
In South Africa, what transpired was immediately in March, there was a complete lockdown, shutdown of the economy, even when there was not even a single death, because government wanted to try and prevent any acceleration at that time of the problem before putting measures in place. So there was a shutdown immediately in March. And since then, from August, we have seen a phased-in approach of kind of opening of the economy. And currently we are on lockdown 1, where the majority of people are back at work. However, we have seen, or we are continuing to see, a lot of challenges that emanated due to the lockdown, a loss of jobs. There's still a number of people losing jobs, women most affected, as they are the majority of people caring for households in South Africa. Thank you.
Thanks, Maureen. And finally, Juliana, what about Costa Rica? And I know you also maybe have some comparisons with other countries in the region.
Hello to all. Thank you for having me as part of this relevant conversation. Yes, I guess most of you know that Latin America has many million people, right? Over 630 million people, 60% of which live in 3 countries, Mexico, Brazil, and Argentina. Of all of these people, Costa Rica accounts for only 5 million people, under 6 million people. Still, Costa Rica has been an important reference in the Latin American context because it was able to build an extraordinary social protection system during the 20th century, even though it had a tiny economy. Costa Rica started off this pandemic with a very strong healthcare system, and that's been a plus. But at the same time, Costa Rica's social protection system relies heavily on payroll taxes, both to take care of social insurance and this is a very unique feature of Costa Rica, to take care of social assistance programs. So my payroll taxes takes care of my social insurance, but also of a number of social assistance programs. And because unemployment has gone from 12% in February to 24% in July, and with underemployment, we are reaching a labor force under problems. Like 60% of the labor force is struggling at the moment. The funding of this strong social protection system is melting down at the same time that we have all this incredible demand for healthcare, for food, you name it, right? So Costa Rica is at a crossroad. The problem doesn't start with the pandemic as far as the political economy of funding its social protection system.
We'll come back to that, Juliana. That's really important. It's great that you started off there, and we'll come back to that. And I think that's a really good segue then to Margaret to talk to us a little bit about where, social protection is everybody. The whole social protection system, both social assistance and social insurance, becomes so important. One, just to get cash to people in light of the rising needs, but also because of the huge increases in unemployment, underemployment, people's just lack of livelihood. So what is social protection doing well, Margaret? And let's, why don't you start us off with that?
So good morning, it's a pleasure being here. I think in a conversation like this, in a moment like this, it's always important to think about what standard we're using when we dimension our question, or our answers. So by the standard of the enormous needs we've just heard, the immense lockdowns, the immense loss of both formal sector employment and income in the informal sector, like no policy response is ever really going to get there. If you judge by what we've seen in past crises, what we might have been able to expect in January, the social protection response has been phenomenal. It has been enormous. It has been at a scale never heard of before in many countries, which is not to say that it's met all of the needs, but there has been dramatic policy action. And I would say that policy action, it covers the waterfront. The countries that have good unemployment insurance systems have extended those benefits, have tried to do schemes to keep people in work, et cetera, but that's a reduced number of countries for a reduced number of people. So the thing we've seen bigger is first taking less money from people, so all sorts of waivers on utility bills and on the contributions to Social Security. And then we've seen lots and lots and lots, this is the most common action, of cash transfers in various ways, either topping up the targeted existing cash transfers or all sorts of sudden, inventive, innovative, do what could be done to bring in informal sector workers who are not previously covered. So the good news is the scale. But this is a panel about women, about gender. So let's talk a moment about that. So I think in these moments of crisis, the scale and the speed were the two things that had to dominate response, and they did. So those were like the only two policy objectives that were really front of mind. And all of the other things about, sustainability, inclusion, empowerment, gender sensitivity, the 29 other positive adjectives that you want to have for your social protection system, those took a little bit of a back seat, I think, which meant that then all those responses, in some cases, were very gender empowering because that's where the system had been to start with. So if the payment was already in the name of women in a program that had all of the gender sensitivities, and that's what got scaled up, then it was pretty gender sensitive. In other countries, that wasn't what the starting point was. And so the payments went to the male head of household, whereas it may have been the women that were losing their informal sector employment. So the balance of who held resources shifted in different ways in different countries. So I think I'll stop there. But clearly there's more that can be said on any of that.
Thanks, Margaret. I think the point you made about the starting point is really important. I'd like to hear from our three other panelists about what do you think has worked well in each of your countries with your social protection system. So let me start with Maureen on this one, and then I'll go to Renana and to Juliana.
With us, what worked well was, maybe I should start by saying, as a country, you know that we have high levels of unemployment, we have high levels of inequality and poverty. But the good thing about South Africa is that we have an extensive social protection program that covers a lot of our people. However, there are gaps in the system. So what happened immediately after March, in April, measures were put in place to extend the measures that government already offer. Maybe to talk about social assistance, you know that with social assistance, we are covering over 18 million beneficiaries receiving different programs. The child support, the biggest is the child support grant with almost 13 million beneficiaries which are children from poor households. And we have other almost 4.95 million covering other forms of grants. So what happened, we also have other measures in social insurance such as the UIF, etc. So what happened after, in April, government extended the scale of coverage. Firstly, what we did, we topped up the existing measures that we had. So we put more money on the child support grant on the for the next 6 months. So people were covered from that time up to October. And what we also did, because we have a big group of our people, 18 to 19, that are not covered by our social protection. They can only, the only people who are able to receive any provision are those who are living with disabilities and older persons thereafter. So the group between 18 and 59, it's a huge group in our country that we are currently not covering in social assistance. And these are able people, but they're not able to work because of the levels of unemployment in the country. So what we did, we introduced a temporary a provision that we named the 350 COVID grant that we offered to people who are between 18 and 59. We started with 18 because already we have coverage from 0 to 18. So we started from 18 to 59, offered and made provision available for that group or that target group. What we also did, we offered UIF for those who were losing their jobs. So we extended UIF because normally UIF is given to a certain category of people, but we relaxed the provision so that we could expand or bring in a lot of people in the program. And what also helped us was we already had a database of people that were receiving other food nutrition interventions in government, faith-based organization, NGO. So we all came together to complement what we are offering in terms of cash. And I think for us, what really assisted was we had a database already. We had a starting point, a database that we could start with. But the reach in terms of, but we will talk later about what were the challenges in doing that. So for us, what really assisted was having measures already in place. And for us was just to extend coverage.
So Juliana, so Maureen, I want to ask you something very specific, because you're echoing the response I think that Margaret gave in terms of scale and speed. But as you rolled this out, did you have anything specific that was targeted to women? Did you do anything more for women to alleviate the types of burdens that we have discussed in terms of a top-up that covered childcare? Did you focus in those industries or those categories for women specifically? Maybe you can say a word about that before we move on.
Okay, I think for us, what was easier, for example, with our social assistance program, the majority of our beneficiaries are women. For example, with the child support grant, 98% of the caregivers are women. So when we targeted these groups, we knew that the people who will benefit more were women. And those who are in low income jobs in the country, the majority of those are women as well. So our provision already, although we did not say directly we are intervening for women, but the nature of it, by the nature or the design of the program, the majority of people who are going to benefit and who are still benefiting are women.
Thanks you so much, Maureen. Renana, what about the social protection system in India? You're on mute.
Yes. Well, as others have said, in a crisis like this, the government can really only build on systems which already exist. You can't build a new system immediately. And the one system that I think has worked really well in India, and it doesn't exist in many other countries, is what we call the public distribution system, where poor families, and that's about 60% of the population, gets a certain amount of food grain really, wheat or rice, for a very subsidized price. And that the government put a huge amount of effort, gave free wheat or rice. And by the first 2 months were a little difficult, didn't reach everybody, but by the third month it was reaching. And that helped the hunger, which was very widespread during the lockdown. And that is going to continue till November. The other big programs in India didn't work that well. The cash transfers is patchy. We have an employment guarantee scheme, but again, it has reached very few. So I would say what came from the government side, that was the best system that worked. But there was a surprise which happened, and I think it needs to be acknowledged. And the surprise is that this lockdown and crisis threw up a huge army of local people, and it became really a system of decentralized governance. Now, within SEVA, we saw that happen where women local leaders were very active, but it was not only within SEVA, it was in the government. The most active were what we call the frontline workers, the health workers, mostly women, the education workers, mostly women, the childcare workers, all women. So these were the women who were going about during COVID, reaching out. And we did a small study of 250 such women leaders. And we found that they reached out to 280,000 families and provided many, many things. Of course, they provided COVID awareness. They linked to government programs. They got relief to over 100,000 of them. They brought in livelihood and development opportunities. So I think this is something that has happened. And I just wanted to give a couple of types of examples. For example, in a very mountainous area called Uttarakhand in India, we had some women who were financial agents. They upgraded their financial technology. They obtained essential service passes after much negotiation, and they reached out to the scattered communities, making sure that they got money from their pensions, from their accounts when they needed it. If these people hadn't been there, nobody would have got money in these ways. Another example is in a village in Orissa. Everybody was not being fed. These women got together, talked to the local government, and started community kitchens and made sure that everybody got food. Or another place, they organized community transport because ill people were not being taken to the hospitals. There was no transport. So they got community transport, got permission, and used local motorbikes and private cars, and got pregnant women, really ill people, TB patients to the hospitals. So that's just some examples. And as I said, it's not just SEVA, it was everywhere.
Yeah, it's really important examples. And I think I want to come back to that in terms of how people and communities are responding, particularly where there are gaps in the system. But let me go to Juliana. You have a strong pre-existing system, as you mentioned. And but you also mentioned, I want you to say a little bit more, and then I'm going to ask this of all of the panels. I want to go now to where the challenges and the missed opportunities, because I think, with the beginning, it was scale and speed. We couldn't do it seems like governments couldn't do very much more, particularly to address the gender specific constraints. But now as we go forward, how can we become more intentional and deliberate? And I'm really interested in how do we go beyond, and I would like to hear more specifically about coverage of informal workers. I'd like to hear more specifically about what else. Cash is critically important. But you also mentioned that the cash may end soon, or certainly for some of them. How do we think about the future right now in terms of what we do? So Juliana, I'm going to start with you here.
Okay, let me say something about what worked well, and let me agree that with Margaret and others that the scale and speed of cash transfers has worked, and so has some incipient conversation about family responsibility as a criterion to access social protection. So I would stress both things. Massive cash transfers, this happened across the board in all Latin American countries, A, and B, to a much less extent, but still half full glass, right? A conversation around family responsibility as a key criteria for people to access to social protection.
What do you mean by family responsibility? Can you spell that out?
I mean, what do people do when families have become the great adjuster, right? When families are expected to take care of everything from income provision to homeschooling, primary care, dealing with people who were not care dependent in February, but all of a sudden in March had become care dependent because they were over 65 years of age and couldn't go out on their own to get basic things like food and medicine. So we have like the main strategy that governments across the region have had is to rely on families, right? States came second. The first line of defense was families. And when you say families, you say unpaid work and you say women's work, right? Before the pandemic, almost half of all working hours in Latin America were unpaid hours, right? And 70% to 80% of all of these hours were in women's hands. As your work, Karen, and others at the World Bank show, this has only increased with the pandemic, right? We have statistics for the US, for instance, that show that unpaid work went from 30 hours per week to almost 60 hours per week, right? And that 8 out of 10 of these hours are in women's hands. We don't see any transformation of the sexual division of labor so far. To the contrary, we see the sexual division of labor working at its full speed, right? So what governments did well was to mobilize cash transfers, like, you know, unemployment insurance targeted mostly men, and very few countries in Latin America have this insurance. Social assistance targeted mostly women, and most Latin American countries have these programs. But thirdly, the one innovation was to create or expand programs that targeted informal workers, which is a concern that several people in the Q&A are raising. Informal workers before the pandemic were neither under social insurance nor under social assistance, right? Because they did have income and earnings of their own. And overnight, they lost this income. So we do see a very interesting narrowing of the social protection gap among informal workers. In some countries, a great progress, in some other countries, small, and in some countries, none. And this is key for women, and this is key for women who are in charge of children, right? I would say that this is important. And in terms of the conversation around family responsibility, in this round, let me just say that countries like Chile and Argentina, for instance, introduced legal measures to make family responsibilities, having young children to take care of, for instance, having children with a school age who are not going to school since March, right, physically, face-to-face, the opportunity to have cash transfers while doing this work and acknowledging that this is work, right? So even though we only have a handful of examples, I would say that this is something that we can go back when we are looking at how we can push this agenda forward, how we can make things better so that social protection really becomes gender sensitive and that care becomes part and parcel of social protection in the form of transfers and in the form of services. We have a great opportunity we should not miss. in the midst of
I
all the
think-
chaos that we are surrounded.
And I think that's a great segue. Let me come back to you, Maureen. I want to ask you, and then I want to come back to the funding challenges. That's coming up. I want to ask you in the next sequence, how do we ensure that people don't fall off the cliff when the temporary measures come to an end? But Maureen, let me just ask you this. How are you thinking about the care challenges more specifically? Are you doing more in the form of additional cash? Are you trying to do more to bring services into the system? How are you thinking about these care challenges?
Okay. Currently, we are working on a policy where we are linking or integrating the grants with services. So it is in the development process. I'm leading that process. So we want to increase the impact of what we are already offering by linking what we are already providing in as benefits to services in general that are rendered by government. So it is one of our priorities as government currently is one of our priorities, but that cannot happen without linking systems, because for you to link services, you need to know who these people are, where they are. So that is why that process of linking our database, so these are running parallel. So we are working on the policy as well as working on a strategy of linking our systems as government. So that is a response to the first question. The second one, in terms of what we are planning to do, currently there is a discussion in the department, and it is led by us, on the basic income grant that we are looking at. As I said, there is a gap between 18 to 59 that we are covering. So that particular proposal this year, we are focusing mainly on that particular proposal and on fast tracking it, targeting. Normally with basic income grant is from 0 to all age, but with us, because already other groups are covered, it will be between 18. What we are proposing is measures to cover 18 to 59. But we are also looking at other policies that we are currently working on, maternal support, but all of them will not work well if they are not integrated. So for us, cash plus services and care has become a priority in moving forward, but as well as coordinating our programs.
That's really important. Margaret, I'd like to bring you back in at this point. I think that interlinkage of services and Cash Plus is really, really important. And where do you see, from your perspective, on the ability of systems to move in this direction, and what's needed for that to happen? Particularly addressing issues like we've heard of, supporting households in care and other dimensions.
Well, I think the Cash Plus agenda has been, it was on the agenda prior to COVID. I think in some ways it took a bit of a pause with COVID, because one of the things we saw in that fast emergency response was simplification. And so the plus part is less simple. I think there are 2 or 3 branches to the plus part. So probably the older branch is the whole thinking about how to foment the development of the kids. So the messaging on nutrition, on parenting, on early childhood development, on getting all the health care and keeping kids in school. So that part has been there. I think the services and education information outreach has become increasingly active. And when it comes to the gender sensitivity of it, I think there's an increased awareness that when this agenda started a few years ago, many of the messages seemed to be all about the mother being the person who did all this work. And I think there's increased awareness now that it is parenting, and that kids have fathers, and that child rearing actually takes, the whole extended family in the village. So the messaging needs to be much more nuanced than it was. But I think that's a nascent agenda, and it really fights cultural norms. So it may take a while to get as far as we'd like it. The other side that I think is intensified by COVID is the Cash Plus, in the sense of developing livelihoods and financial inclusion and support to the household enterprise, or the female entrepreneurs enterprise. And that's an agenda where we have you know, all of the recent work on the random controlled trials showing how some of these programs can really work, the whole graduation agenda. So far, the sweep of the idea is running around the world. The scale of the programs is still tiny. It is just tiny compared to even the number of people who are getting social assistance pre-crisis, and barely a drop in the bucket compared to all of the people who enterprises were set back by the Depression. So I think there's going to be a real focus on that. But it's going to be tricky, both to get the scale and to think about, you know, the lockdowns are in most places eased, but the recession, depression, economic gloom is very generalized. We don't know how many months or years it will take to claw out of. But as we claw out of it, I mean, we fell off a cliff with the lockdown. We're going to like climb up a possibly gently sloping hill on the way back up. And different people and different families will move at different speeds. So whether the support is customizable or the assistance just runs out and there's no money and some people fall off a cliff and other people climb up, or whether we can somehow fine tune a bit, is going to be the tricky bit. And it's a really difficult technical problem, even where there is societal agreement about it, and that may not be that easy to get either.
So Margaret, I really appreciate these 4 dimensions that you emphasized of plus, from children's services, the gender sensitivity, and the support on the economic side for livelihoods and microenterprises. I'm going to come to Renana in a minute. But Margaret, what ideas do you have, before I go to everybody else and ask this question, for how countries can keep the funding going so that people don't, and how these measures don't come to an abrupt end in November, October, and so forth, so people don't fall off a cliff? What's the policy advice you're giving?
Easier said than done. So that dramatic scale of
Margaret, I think we've just lost you.
May I jump in while she comes back?
Hold on 1 minute, Juliana. Margaret?
Lines are about these things are important.
Sorry, Margaret, we had missed
back.
a lot of what you. Margaret, we missed a lot of what you said. You were temporarily lost to us. Can you just start again quickly?
Right. Sure. So the things that were funded were often done out of deficit spending, which I think everybody agreed was important to the moment. The IFIs are talking about at least some debt relief for the lowest income countries, but the scale of fiscal problem is just going to keep growing the longer we go. And we've seen not only that the spending went up, but that the revenues went down. So that gradual process that had been going on over the last decade of making the case for social protection, and of governments raising revenue and of rededicating revenues and reforming, you know, allocations, a lot of ground was lost on the revenue side because of the crisis. So there is inevitably going to be very difficult questions about where governments spend money. Do they spend it rebuilding the education sector? Do they spend it on the health sector, which, you know, the whole vaccination thing is still to come? Do they spend it on some other means that they think will restart an economy? I don't think we can escape the fact that there are going to be some really hard conversations there.
Juliana, I'll come back to you in just a minute, but I'd like first to give the floor to Renana to comment a little bit more on the plus side, because I know in India they've been thinking about that. And here I think the link to community approaches is really important, but then also your ideas on not falling off the cliff, Renana, would be helpful. And then we'll come back to you, Juliana, because I know you're dying to get into this conversation. Go ahead.
I'm sorry, Karen, I didn't get your question. Do you mean what's going to happen when the relief stops? Is that what you're asking?
No, I wanted you to say a little bit more about the plus side in terms of how social protection can be, as Margaret had mentioned, needs to be extended to micro entrepreneurs to help on the economic side, for them to get back on their feet, and also in terms of the care side. So can you say a little bit about that before you get to the ideas for what you think should happen so we don't fall off the cliff?
Oh, okay. Well, about falling off the cliff, the only cliff that we may fall off really in India is when the food stops. So there's not much else going on right now in terms of relief. Um, I think a couple of things. I'd really like to emphasize that in India, we have a very large informal sector, and women are mostly in that informal sector. Agriculture, women in agriculture, people in agriculture were less affected in the lockdown, were affected, of course, but less affected than in non-agriculture. And we unfortunately have very little social security systems for them. So unless we really think of now a proper social security system for the informal sector, we are going to have the same thing happening again and again. The plus side, I mean, for example, as you mentioned, micro-entrepreneurs, we have 12 million very, very small women micro-entrepreneurs in the country. And what we are seeing is that they have lost capital. And of course, like everybody else, the markets are down. So they've also lost their markets. And some of the policies also have not been that positive. For example, street vendors, the government opened malls, but they didn't open street vending. So I think some of the things that have been recognized by the government, and we're talking about the pluses, is the need for small micro enterprises to have capital. They have a special scheme for micro loans for street vendors, but only for street vendors and no other micro enterprises. So that's a huge opportunity. Another is what has been recognized is the invisibility in the sense that they're not documented of the informal sector and of migrants. And I think there has been some movement now within the government towards actual documentation of these people. The third big...
So wait, Renana, just on that, we had a question in the chat. Are PDS cards accessible now to migrants so they can access food entitlements? Is that what you're referring to specifically?
No, not so. But what did happen is that even if you didn't have a PDS card, you could access food. So different states had different ways. So some states had what they called e-passes, where you could, or e-cards, where you could register yourself and get it. Some states had sudden giving out of PDS cards. Some states just gave it. But of course, that was a big gap and remains a gap. But as long as the relief is on, the food is being given out. But this took a while to happen. I'm sorry, I'm still responding to the question. Yeah. And so for the first 2 months, the PDS was not, the migrants were not given food. And that is one of the reasons, not the only, but one of the reasons that led to this huge migration of 10 million people walking home.
Yeah.
So, yeah.
Juliana, I know you've been dying to jump in on the conversation about how we not have populations, vulnerable populations particularly fall off the cliff, and what we think we need to do. So I'm really interested, because you started our conversation with the idea of the fact that obviously revenues are down, needs are up. What do you want to say about this now, in addition to the other parts of the conversation?
Let me just get to a comment made by Shara Razavi. She pointed out correctly, I think, that scale and speed has been on the positive side, but sufficiency, generosity has not. And this has to do with both the amount of cash transfers and the duration, right? This is a crisis we do not know how long will it last, and we do not know whether we'll be back in a second to strict lockdowns and so on and so forth. So this increases the challenge. The second thing is that it's really worrisome that in Latin America, where women were at the center stage of social policy innovation between 2000 and 2015, suddenly women are nowhere to be seen. For the most part, women, gender relations is not at the center stage of policy design, and we must change this. Thirdly, Latin America has, according to ILO, the highest loss in earnings and jobs in the world if we compare to the pre-pandemic situation. And it's disproportionate female, right? So we have a huge problem there. Now, we are not going to be able to deal with this if we do not tackle care work and care responsibilities, right? So this is urgent, and this means we need to address transfers and services. And we also need to address regulations and what businesses have to do as far as regulating and going back to ILO's agreement 156 for people with family responsibilities. I think there we have a tool that many governments had agreed with, and there's a lot to be done as far as honoring this agreement. Right now, of course, there is a huge need for funding. And this is where I think segmentation becomes a problem. I don't see the financial issue as a technical problem. I see it as a political economy problem. And the more segmented systems are, the less likely is that we'll bring people together and will bring women and men concerned with care, particularly, to come up with shared solutions. So I see care and family responsibilities to take care of care demands as an opportunity to create cross-class coalitions, because this is a very hot, difficult issue for women across the board. And even though it's true that women who are better off can still rely on paid domestic service and can even have, women working, like leave their families alone and come and stay and be part of social bubbles, right? So there is a high stratification of how families and women are dealing with social bubbles and social distances and so on and so forth. Still, I would say that roughly 60% of families and women in Latin America are coping in some way or another with the stress of dealing with income generation strategies and taking care of care-dependent family members. So I think that this trajectory, this incipient policy design that we are seeing in Latin America, as far as addressing informal workers who in February were probably middle class, low class, they were a heterogeneous group of people. Addressing this group of people may give us an opportunity to come up with ideas that expand the pool of resources, right? We know, but we have several studies, recent studies, that show that middle income countries such as Latin America can mobilize domestic resources. We cannot take for granted that the resources we have are the resources we have. If we do that, we can do that, but then this is the end of the conversation, right? So we do need to challenge that. And I mean, the very, very rich and the 1%, at least in Latin America, are not contributing as they should. And some of them have become richer as we speak. So this conversation it's very hard to keep talking about social protection aside from the fact that this deep inequality is creating this dilemma. We need more redistribution in scenarios that are less friendly to distribute, right? And
Margaret, do you want to make a quick response to that before I go to Maureen?
I started my professional training and have done much of my service in Latin America. So my first response is amen. But I think this notion that COVID puts very squarely into the conversation, what kind of societies do we want to have? And the realization that the ones we have aren't exactly the ones we want. So I think it's going to be very interesting in coming months to see this huge expectation of response. I mean, and I will speak as an American citizen, for example, always a little stingy on the safety net and social protection side, our country. Suddenly we have big responses in much more political support for them than we have ever seen before. So we also have this huge deficit problem. So whether this will change permanently the conversation and say, we need to have better social protection permanently, or whether that will be seen as some kind of aberration that goes away, I think is going to be a very interesting conversation. But the other side I would add is that not only have we raised a big political expectation in some ways, at the same time that we've raised a big financial barrier, we've also changed the game technically in a lot of countries. So we haven't talked as much about the huge innovations in bringing in the informal sector, in using databases that have never been used before, in getting people linked into systems that were never in the systems before. I think that's going to be a positive ratchet effect, that we now know who's who in a way we didn't, not in every country. And the big move to digitalization surely is going to take a little backstopping to go back and solve some of the errors of exclusion that came about by the fast action. But the notion that we can simplify transactions, that we can have more accountability, all of those things that, you know, SP, ID, payment systems have kind of gone hand in hand, with SP being the friendly face to these other agencies trying to, and we've seen in country after country, how if you link these things together, we can help build across the digital divide. Not solve it completely, but make a big step. So I think that's one of the things that we will certainly see some positive ratchet on, and that we may be able to continue to good advantage in the future, which will then help build some of that social protection for the informal sector.
Thanks, Margaret. Maureen, do you want to pick up on some of the themes that Margaret just mentioned in terms of, you know, the opportunity that's in front of us, and particularly around digitalization and, you know, the inclusion of those who are formerly excluded? And I have one more question. Go ahead and pick up on that.
Okay. Thank you. Before COVID-19, the country was already in a bad economic situation. So COVID-19 increased that burden. However, we cannot run away from the fact that the majority of our people are poor and they need to be assisted. So for me, prioritization of social assistance, of cash transfer cannot be compromised, or we cannot go back. What we need to do, in my view, would be to expand social assistance to ensure that the people that are not in the system do access the grant, but we should not end there. I think it's important that we should also work towards ensuring that we build up our economy so that the people that needs to work can be able to do so. Because our people, it's not that they do not want to work, it's because there is no work currently that they can do. So we need to strengthen our economy to allow our people to exit the system. But currently, the priority should be, or should remain, expanding social assistance. And we already are working on a policy that targets the informal workers. It's still in development, and in the future, we will be able to speak more on that. In terms of, I think what is also important is to ensure that our systems are integrated, because that will ensure that we save a lot of funds, because currently you will find duplication there and there, you will find, and it's just because our systems are fragmented, our systems, so we need to put more resources in building our systems, in integrating all of our systems. And here, when I talk about all our systems, I talk about social protection, both social assistance, social insurance, and welfare, ensuring that they are all integrated and are monitored on a monthly basis. I think that will assist going forward.
And digitalization will be helpful and enabler of that. Is that correct?
Absolutely, absolutely. We need to digitalize our programs, all of them. And as I said earlier, before we started this conversation, that as government, we have started that process of coming together to come up with a strategy of bringing our programs together and bringing our systems together and ensuring that all of our systems are integrated and are digitalized.
Thank you. I'd like to give the last word to Renana now in terms of the opportunity that we need to, and the pivot that we need to make going forward. So last word over to you, Renana, before we close.
Thank you, Karen. And I'll pick up what Maureen just said, which is the importance of digitalization. Especially, I come back to the informal sector. What we really need is recording and digitalization of all the information that exists for this huge sector. And only then can real social protection programs be made for them. I think the government has taken a step by passing something they call the Social Security Code, which includes the informal sector in it. The second thing I'd like to say, especially for India, is that whereas other countries have relied on cash transfers almost to basic income, India cash transfers are very patchy. And there has been a lot of talk, though no commitment yet, for really extending the cash transfer system, maybe to some form of basic income. Another thing that came out is the importance of community, as I mentioned, and the importance of mobilizing people in their own social protection. And I think that has been recognized. And in fact, we've done a paper called the Last Mile Model, which we hope will, generate some kind of policy discussions. And finally, I think especially for India, India is a country of micro enterprises who generally are left out of systems. And I think that is being recognized, and hopefully that will go forward too.
Thank you. We're almost out of time, and I think this conversation could go on for another 2 hours, and we would still have much more to discuss. I'd like, first of all, to call everybody's attention to the SPEAC-B call to action. I think the call will be put on the chat. There's many resources put on the chat. Just in conclusion, I'd like to flag a few things. I think we've all recognized the importance of Social Security and social protection for informal workers. That's the frontier that we have to move toward with digitalization, but we can't forget that there's a gender digital divide. We can't digitalize unless we give women as much or more access to the smartphones and the technology and the literacy to be able to access and use those systems. I think we still have some more work that we have to do in terms of we didn't talk about this, but expanding the social registries and the database. I'd like to mention the integration of many services. And here I want to actually say, I think the recognition of care has to be made as a service. It's as essential a service as health services, as education services. So recognizing and financing care is, I think, something that's really important in our frontier. And there's probably another conversation to be had on different models that countries could follow to recognize care. But one thing we didn't talk about, at least in terms of emergencies, care as something in a public works program is an idea that has been discussed in different places. It was used in Argentina. It's been used partly in India and other places, but care is something that's important, mindful of the public health implementations. I think the hardest conversation is really on making these measures more permanent and how we finance that. And there's many trade-offs, as Margaret mentioned to us, and this is a really important conversation to continue. With that, we're at 9 o'clock. I'd like to thank you all for joining, for your questions. I know the recording will be made available, and I'd like to give a special thank you to Margaret, to Renana, to Juliana, and to Maureen, and to the organizers of this session. And with that, I'd like to say goodbye, good day, good evening, and good rest of your weeks. Thank you, everybody.
And thank you, Karen, for a very interesting set of questions and leading us into an interesting discussion.
Thank you, everybody. Bye-bye.
Bye.
Bye.